This is a continuation and can show the long-term follow-up after treating plantar fasciitis with shockwave therapy. As the previous speaker says, plantar fasciitis is a very common cause of heel pain, and the exact cause of this pain or this inflammatory reaction is not well known. Treatment modalities failure is up to 30%. And according to the literature, during the last decade, we saw that shockwave therapy find its place, especially dealing with the soft tissue problems and in orthopedics. The short-term success of extracorporeal shockwave therapy, according to our experience, is high, and it was higher than 90%. The goals of our study was to assess the long-term follow-up of treating plantar fasciitis with the extracorporeal shockwave therapy. We choose recalcitrant patient, usually have pain longer than 6 months, and we wanted to evaluate what is the long-term follow-up. Including criteria were, as I said before, recalcitrant plantar fasciitis, which means that it's longer than 6 months, and the history of unsuccessful conventional treatment, which contain non-steroid usual or physiotherapy, local injections, heel cups, stretchings, and physiotherapy. And we wanted a follow-up longer than 4 years since completion of the treatment. The exclusion criteria were local infection, pregnancy, any kind of coagulation disorders, any history of rheumatic disease, neurological disorders, and any kind of local tumors, because there is not enough details about the influence of the shockwave, about the biology of the tumors. The treatment protocol consists of 5 successive sessions of 1,500 impulses. The impulse was 0.32 millijoule per square millimeters, creating a pressure of 38, almost 39 millipascal, and no further treatment was done. The evaluation was physical examination, foot and ankle examination, AOFAS Hindfoot score, analyzing pain by VAS score, and we evaluate before treatment, 1 month, 1 year, and 4 years or more post-treatment. This is the demographic of the patient. We see that they are more or less were about 57 years old, and the BMI was almost 29, so not very fat or not very thin. Totally, we started with 50 patients. At the follow-up, we got, after 4 years, only 41 patients, 34 women and 7 men. Totally, we have 52 heels. There was no significant differences between the BMI. The AOFAS Hindfoot gives 40 points for pain, 45 for function, and alignment is 15 points, which is not changed at all. And the VAS we evaluate according to 6 parameters, ranging from 0, which is not pain at all, and 10 is severely pain. And we evaluate it in the first steps in the morning, maximum intensity during the day, during prolonged walking, during standing, the end of the day, and then during the night. This is the AOFAS scores. It started from pre-treatment from 51 plus minus 16.3 points, and after 1 year it increased to 94.5, and after 4 years decreased to 51, and below we see the range. We found there is a significant difference between the pre-treatment and the 1 year and 4 year follow-up, but we didn't find any differences between 1 year and 4 year follow-up. It means that we find an improvement during the years. It decreased a little bit, but the decrease was not significant compared to what we found after 1 year. We same the same manner when we evaluate the VAS. It was 43 from 60 at the beginning, before treatment, and it decreased after 1 year to 5.3, and after 4 years it's a little bit increased to 6.8. Again, no difference between 1 year and 4 year follow-up, and both of them are significantly improved compared to the intensity before treatment. This is from the literature. Shockwave therapy considers as a non-intervention method, and it may be preferable to cortisone injections. The VAS scores decrease by 64%. We find a little bit higher, and there is no complication with the treatment except very mild discomfort during the treatment. In conclusion, we found that the ESWT, the shockwave therapy, was beneficial, and we see at 1 year and after 4 years that it's keep on significant. It means that if it improved, it will improve at least for 4 years or more. There was no recurrence during the investigated period, and we found that ESWT shockwave therapy is safe and efficient treatment for recalcitrant plantar fasciitis. And what is important that there was no side effect except temporary inconvenience during the treatment. This is all. Thank you.